Well, has your lower back ever hurt? How about you? You ever have lower back pain?
Yeah, more so my neck all the time, every night.
Lower back pain's been a problem for me, and the pain, it can be excruciating, impact your lifestyle.
Yeah, it's not fun. Plus, oftentimes the pain does reoccur after treatment.
Yeah.
So why does this happen?
Well, we're getting the answers from Dr. Drew Drummond of Spinal Balance Health Center. Good to see you, Dr. Drew.
Thanks.
Welcome
it's great to be
back.
here. Hi.
This lower back problem, I mean, it turns you into a senior citizen pretty quickly, no matter how young you are. You know what I mean?
Yeah.
It can be debilitating. So, but there's so many treatment options out there for lower back pain.
Yeah, there are. It's a kind of a complicated issue. The problem, people want to think of the low back as it's kind of in a vacuum, and the problems in the low back start in the low back, they end in the low back, so we kind of focus on the low back. But in reality, it's a series of steps and stages physiologically that happen to finally get to this low back problem. And so the low back isn't really the weakest part of the spine like you might think. It's actually the strongest, most stable, most dynamic area, and it adapts to other problems. So if you don't figure out why the low back is having to adapt, then you never get to fix the problem. So an example of this would be, like we're all familiar with holding a suitcase or a heavy bucket of water. When that pulls your body off its center of gravity, it's the low back that has to adapt the most so you don't fall over. And there are some problems that aren't as short-term as carrying a suitcase, but rather they'll pull your body off its center of gravity for months and years and decades. And that's when it becomes chronic, is when you don't figure those problems out, but you just treat it like a low back problem.
And that's funny because I've always thought the lower back, it's like, why was the human created with such low back problems? It's not the low back, it's actually pretty strong.
The low back has the biggest joints, the biggest facets, which are posterior joints, the biggest discs, the most muscle. There's no anatomical reason why that back should wear out other than we put demands on it that it wasn't designed to do.
So let's talk about treating it, because a lot of people that have this problem, like we said, there's plenty of them, are having a hard time finding the best treatment option. How do they go about that?
Well, what I tell my patients is try to get back to the original problem that's leading into the stress in the low back. The low back is way at the end of the chain of events that finally end up as pain. So if you treat it there, it will constantly keep coming back. But if you can track it back or find somebody to help you track it back to the original problem and fix that, then you can actually stop that chain of events. So try and find the least invasive treatment that gets as far back to the beginning of the problem as you can.
And by least invasive, you mean surgery, not an option at that point, right?
Surgery is the most invasive thing.
And that's what you're trying to avoid.
Way at the end of the problem. That's that's the worst thing to have to wait for that. Sometimes it's necessary, but to wait for that, that's a horrible option.
And so you really deal with the misalignments, and you deal with the misalignments at the top of the neck.
Yes.
So how does the top of the neck, the misalignment there, how invasive can that be, and then how does it affect the lower back?
Yeah. At the top of the neck, this is the weakest part of the spine, where the low back is the strongest, most stable part. The top of the neck is the weakest. And the left-hand picture here shows what the head and neck and atlas how it should be aligned. The right-hand picture shows what happens after accidents and injuries. It can be childhood accidents. It can go all the way back to birth trauma. It can be rear-ending accidents where you get a whiplash. But that bone out of place starts now interfering with the nerves at the top of your neck. And those nerves control a lot of different functions, one of which is your body's posture and the ability to balance. So the right-hand picture here shows what a body would look like if the muscles are all doing what the nerves are controlling the muscles properly, pulling you into a nice balanced posture. The left side is what happens to people that have an upper cervical misalignment, which is what we correct. It causes one side of the back to tighten. And as long as that misalignment is there, you constantly have muscles on one side of your back that are tight, creating, if you can see way at the bottom, a short leg. And you have to adapt to that. And this sometimes happens to people when they're children, and they live with this adaptation for years and decades, forcing the low back to have to tweak. And then they turn 30 and all of a sudden they think of themselves as having a low back problem, and why is my low back bothering me? But in reality, the low back has been the solution to a different problem for so long that it finally wore out.
That's really extensive, isn't it?
It is. It is very complicated.
I mean, it really is,
Yeah.
But once a person begins treatment, how long then does it take to start feeling better? I mean, I know it's different for everybody, but...
Yes. Once we correct the top of the neck and getting that back to where it's not interfering with nerves anymore, I've had people just earlier this week, today's Tuesday, so actually on Friday, we had a kid that we adjusted and he was pain-free off the table. Just one adjustment.
Right away.
Yeah, and I would say I wouldn't recommend people come in thinking that's going to happen.
Right. That's not the normal.
No, more of the time I get people that have had the problem so long that we'll adjust the atlas, we'll straighten them up, and immediately they'll feel more balanced. And then slowly over time they'll get better.
But that, the adjustments, it's not painful.
Oh no, the adjustment's very light. It doesn't take much force to move the top bone of the neck back in the right position. It just takes a very skillful set of x-rays, a very accurate adjustment. Once that bone is in the right place, then the body just does it on its own.
Well, you always bring in a special offer for our viewers. Today it is the first 15 people who call Dr. Drummond's office will receive a consultation, x-rays, and exam for just $50.
Yeah, it's a great way. It's very risk-free, and it allows me to look at somebody and tell me if I think I can help them before they have a lot of investment and time involved in any kind of treatment.
Yeah, it's a tremendous value. The x-rays alone, I mean, those can get pretty expensive. SpinalBalanceHC.com, that's the website you can go to. Dr. Drew, thanks for coming in. Good to see you.
Thank you. It was nice seeing you guys again.
Well, on yesterday's